So these are some of the things I packed in my hospital bag. These are Lumi deodorant body wipes. These were very useful. I definitely suggest those if you can get a hold of them. And I also got the Neutrogena individually wrapped face wipes. Those were actually very helpful as well. Definitely used those and would suggest them. I brought an extra Summer's Eve feminine wipe just in case the Lumi wasn't enough. Also in my bag, I made sure I had an additional small little zipper bag that I wanted to keep by my bedside, or, on the bed with me with things that I might need more frequently. That's my portable charger, that connects to the back of my phone with MagSafe. And I also brought with me the just a regular phone charger. That charger also can charge that portable charger, just in case. And also if like maybe my sister was with me and she would need it. I brought a mirror. I have locks, so I didn't need the brush part, but a mirror just in case. And that I didn't end up using, so I don't know if that's necessary. These are lubricating eye drops that I brought just in case I get super dry eyes. I didn't end up using those, but I still would have brought them. And then I brought 2 different types of chapstick. I definitely suggest that. If you have unscented chapstick, use that as well. Then some hand lotion and another type of chapstick. So your lips will be extremely dry and your hands and your body will be dry. This is a face moisturizer. This was very useful. I would definitely suggest you bring that since you're not allowed to moisturize your face before surgery. It will be very dry after. I brought my wallet, of course. And then I also brought some hand sanitizer, which wasn't totally necessary because the hospital did provide me with a bottle of hand sanitizer. And then I brought some aromatherapy spray. I don't know why I brought it. I guess I thought it would be just in case the hospital room smelled some kind of way that bothered me, but my senses of smell were so sensitive, there's no way I could have sprayed that. This is called a Clippa. I attach this to my hospital bag, my backpack, so that if I wanted to connect it to my bed, like my bed rails on the side, I could keep my backpack near me if that was needed. But since they have you up walking all the time, it wasn't necessarily needed. I also brought toothpaste and my electric toothbrush. Definitely use both of those. The morning after you'll want to brush your teeth. My doctors also suggested that I get some yeast infection medication as well as some suppositories to have at home after. So I just went ahead and ordered these off of Amazon. The antibiotics can cause a yeast infection after surgery, so it's good to have something at home already. And then suppositories will be through this whole process of eating just in case I get constipation. Then I also got the dissolvable Tylenol packs. This is the pre-surgery drink, the Ensure. I had to drink one the night before and another one hour before surgery. And then this is the antibacterial like soap that they have you bathe in the night before and the morning of. So this is me after surgery. This is the morning after the surgery. I was not feeling well enough to turn on the camera the day of surgery, but this is me first feeling okay for the first time the next day. And here's a little tour of my hospital room. Thank goodness I did have a room to myself and my own bathroom in the hospital room, which was very helpful to have. Like I said, those Lumi wipes were very, very useful to have. They can be used all over the body, and they were really, really, really helpful because you're doing a lot of walking and you will start sweating, and it's nice to be able to clean up. But yeah, it was a good sized hospital room. Never turned on that TV. I was way too miserable to even care that the TV existed. This couch turns into a bed for your visitors. And this is my tray that had my Gatorade, my 1 ounce cups of Gatorade that I did have to water down because the Gatorade was too painful to drink. And I wasn't able to have the broth or anything else that they gave me, just the Gatorade. But otherwise, this is how it was.
Hey guys. So I am
actually recording this video 3 days after the surgery. I didn't do much recording surgery day or at the hospital because I was in really bad shape. But I wanted to go ahead and make this video before I forget some of the details because I'm doing pretty well right now. And so it makes it a little easier to start forgetting some of the details of what was happening. So I got a call the day before surgery that I was going to be the first surgery of the day. And I had to be at the hospital at 5:45 a.m. Thank the Lord that I have a really great friend who was willing to drive me and my sister, who flew into town the day before, to the hospital at that time. This is also a friend who was taking care of my service dog for me during the surgery. And at the hospital that I went to was about 30 minutes away from where I live. So we get there, we do the check-in process, we go to the waiting room for the surgical area, and then they call my name in like 15 minutes after being there, and they start moving really quickly. You know, it moves really fast. I thought it was going to be a lot of sitting and waiting, and it wasn't. It was a very different experience from the hospital that I had my last surgery at. This hospital definitely isn't as high tech or high end probably as the hospital that I was in California for my last abdominal surgery for a myomectomy, but it was sufficient enough, and it wasn't like it was an old rundown hospital or anything like that, but like they just didn't have some of the amenities that made you more comfortable, and things weren't as streamlined to get you ready for the surgery, but that wasn't 100% necessary. But anyway, I get into, they call me back, they have me put on my gown and wipe down with the antibacterial wipes all around your abdomen and chest. And they, for some reason, when I got back to the waiting room, the nurse that, not the nurse, I guess the receptionist that was telling us where everything was, where's the bathroom, where the cafeteria is, where you know, my sister can get coffee if she wants and stuff like that. She did not say anything to me about don't use the bathroom because they need a urine test before they can start anything. And I didn't know how much I was going to be sitting there waiting, you know, so I really needed to use the bathroom. So because, you know, I had to drink those 2 pre-op Ensure drinks, those glucose drinks. And so, you know, one right before bed and then one an hour before leaving for the hospital. So, you know, my bladder was full. And so I went to the bathroom, and then I got called back like 5 minutes later. And so they were like, we need a urine sample. And I was like, I just went to the bathroom. And she was like, oh, you shouldn't have. There's a huge sign that says don't use the bathroom. I didn't see a sign anywhere, and the receptionist didn't say don't use the bathroom. So that was, you know, them dropping the ball a little bit. I should have, you know, as the lady saw me walking into the bathroom, which is directly next to her desk at the reception, she should have been like, wait, don't use the restroom. They're going to need a urine test. Like, nobody said that. There are a couple of incidents like this at this hospital of people just forgetting things to say or do or tell me. So that was a little disappointing, but it didn't make it a horrible experience. Like, those things didn't make it a horrible experience. But anyway, I managed to get out enough drops for them to be able to do a pregnancy test because that's what they have to do before they can start anything. And so the person who started my IV was fine. The thing that probably wasn't to my advantage that I made a mistake with is, you know, both me and my sister were super nervous about this surgery. So we didn't really sleep. We probably slept like 3, maybe 4 hours. And so because of that, I was really groggy and not as coherent as I should have been. And so as the one nurse is putting in my IV, the other nurse is asking me all of this medical history questions and ask me when's the last time I took this medication and when's the last time I drank this or had that or what time did I take, because, you know, there's a good amount of medication that you have to take leading up the night before the surgery and the morning of and things like that, that your doctor would have called in for you ahead of time, even any anti-nausea medication, which, might I say, I have not had to take any anti-nausea medication since I got home, which I'm surprised because the nausea was out of control in the hospital. But that probably had a lot to do with the fluid built, like the gas the gas was death. It was the worst thing ever. But anyway, so I had all my medications, and she wanted to make sure I had everything, filled, and when I took each medication that I had to take the night before and the morning of and stuff like that. And we, cleared all of that. And but it was really hard for me to answer those questions because I was so tired because I didn't sleep well. So I would say if you can manage to get a good night's sleep before the surgery, get a good night's sleep before it, because you're only making it harder on yourself. And maybe if you have some important questions or you want to be able to advocate for yourself about something, you're going to be less likely to be able to do that if you're completely exhausted. And part of the reason I didn't sleep is because I had to be there so early, so if it was a little bit later in the day, I probably would have been comfortable getting at least 4 or 5 hours, 6 hours of sleep. But knowing it was so early, I was just way too nervous, and I wasn't able to. So it just made it not easy for me to answer the questions. But after all the questions got answered, and I had my IV. Then they called my sister back to wait in the post-op pre-op area. It's like a little tiny room with a shared bathroom with the room beside you. And I don't think I was in there more than 30 minutes, maybe 45 minutes before they were wheeling me back for surgery, and yeah, it was going pretty quickly. So, I mean, I did meet with the anesthesiologist ahead of time. Now, for me personally, everyone has been asking me, all my doctors and even my sister was asking me, how do you handle anesthesia? I've had 4 or 5 surgeries in my life, and I've always handled anesthesia perfectly fine. My last surgery was a while ago. It was in 2014. That was the myomectomy. I've had a few endoscopes since then, but obviously that's, twilight sedation. It's not like deep anesthesia. But I wake up very well from anesthesia. I'm pretty alert pretty fast. I don't have usually any problems with it. That was not the case this time. They used a different combination for anesthesia, and the anesthesiologist did warn me. She's like, I checked your records. I don't see that you've ever had ketamine, and we do use ketamine for anesthesia. So this might be a little bit harder on you. She was right. I really struggled to wake up from that surgery. I have to say, honestly, I wasn't fully awake for probably, let's see, my surgery probably happened around 7 a.m. And I don't think I felt like I was awake fully until 10 o'clock at night that day. So even with having to walk the halls and everything after surgery was almost impossible because I couldn't even keep my eyes open. So ketamine is definitely not something that happens well in my system. And hopefully I never have to have another surgery again. But if I do, thank goodness on my MyChart, the exact combination of anesthesia that I was given is in my MyChart. So I can, go over that with the anesthesiologist next time if I have to have another surgery in the future, to just let them know that this combination wasn't the best for me. Now, if this was a regular surgery where you're encouraged to stay in bed after surgery, the grogginess might not have been a big deal. But for a surgery like this, where you have to get up and start walking immediately after surgery, it's not ideal. So anyway, they roll me back into surgery. Everything seems to be going just fine. And the next thing I know, they put whatever in my IV, and I start falling asleep pretty quickly. And there's no counting or anything. I think they just literally put something in my IV. And then the next thing I know, I'm waking up in the most excruciating pain I've ever felt in my life. And the tube is still down my throat. And so I'm starting to grasp at my face because I feel like I'm choking on the tube. And so they come and remove the tube while I'm awake. So that was a little bit traumatic to be aware of happening. I don't know if I woke up faster than they thought I would, or I don't know what happened, why I was awake with the tube still down my throat. But I had to be awake from them removing that. And then all I could really do after they removed it was moan as loud as I could physically moan because the gas pain was excruciating. Now, this is the issue. I was told by my surgeon's office that, you know, they don't like to give any kind of narcotics or serious painkillers after this surgery because narcotics slow down motility, they cause constipation, they cause nausea and dizziness, and they make you more tired. And these are all things that make it not possible for you to get up and move the way you have to do after the surgery. But they said, however, if your pain is out of control, we will consider giving you pain medication. That is what I was told. I even talked with another girl who was on the same floor as me who had the surgery. She's like, I 100% remember them telling us that over and over, that if your pain was out of control, that they would give it to you. Luckily for that girl, she had a different surgeon than I did, and she wasn't in the same amount of pain I was, but she said she remembers hearing me waking up from the surgery and moaning in so much pain and pleading for some kind of pain relief. All they would give me was Tylenol. That's all I could have. It had no effect whatsoever. You know, they were giving me anti-nausea medication. They were giving me like antacid medication, but and whatever else, like, but nothing to help with the pain. So, and they just kept telling me, like, this is the worst part. This is the worst part. It's gonna pass. We promise. This is the worst part. It was bad. By the time they wheeled me back into, you know, my pre-op room to wait, it wasn't like my hospital assigned room. That's the other strange thing that happened with this hospital, is that they had all of these surgeries, but they had a full hospital. So I had my surgery at 7 a.m. I didn't get put in my actual room that I was going to stay overnight in until 6 p.m. that day. So I was in like the pre-op area, which was probably, you know, I was probably disturbing a lot of patients, honestly, because I was in so much pain. I was moaning as loud as I physically could. And that was the only sound I could make. I could hardly talk. It hurt to move my diaphragm. So I wasn't being very cooperative with questions and talking to them, because I was just like, I can't communicate with you guys unless I get some pain relief. Like, it was just so odd. I'm that person who, when they give you a pain pump after a surgery, I never even push the button. I'm usually fine. I've had many surgeries, and never in my life have I woken up from a surgery in that kind of pain and then never been given anything for relief. You know, I got up and I tried to walk. They were walking me through the hallways immediately. But like, this is the crazy part. I was so groggy and out of it still from the ketamine that they were literally holding me up by my waist and walking me every hour. I couldn't even keep my eyes open. I'm walking with my eyes closed, and they're like, open your eyes, and I couldn't. It was a really weird thing to be doing, to be walking when I wasn't fully like conscious, but they were making me do it anyway. It was really weird. But yeah, it was really odd. So, but my sister was very concerned with my pain level. She kept asking them if there's anything they can give me. They just kept telling her it's just gas pain. She has to get up and walk around. It'll go away. I was struggling. I even as groggy and tired as I was, I couldn't even sleep the rest of the anesthesia off because I was in just too much pain. I was in too much pain to sleep and rest. All I could do was moan as loud as I could. And I know the constant moaning and moaning and moaning had to be disturbing all of the other patients who were recovering, because I don't know how loud I was really projecting, because it was so hard to move the diaphragm at that time, but it was bad. It was bad, you know, and that was a lot of noise to be making with such a hoarse voice after being intubated. But making a loud moaning, droning sound was the only thing that was giving me a tiny bit of relief. It was pretty bad. It was many, many hours of just severe nausea. Every time they would sit me up to walk, the nausea would be out of control. They would keep putting like alcohol pads in front of my face to sniff, because they were like, we have to try your best not to let you vomit, because that's going to just make it all so much worse. But it was bad. I'm not going to lie. Like, I wasn't prepared for that kind of pain because of out of all the surgeries I've had, I've never dealt with pain like that in a surgery before. And obviously doing surgery on like your intestines and your stomach is hard. But I'm like, my myomectomy surgery, I mean, I had a fibroid that was on the outside of my uterus behind my intestines. So they had to move all that out of the way for that as well. And they had to put the air in my abdomen as well for that surgery, but it wasn't like all the way up at the diaphragm. It wasn't air all around the upper part of your abdomen, so it just didn't feel the same. I don't know, but I was crying. I was literally crying and begging the nurses to contact the doctor and ask him if he could make any kind of exception and give me some kind of pain medication. Because I was like, if I could just have, like, I was in a level 9 pain. I didn't say 10 because I felt if I said 10 to them, they would just think I was exaggerating. So I just said 9, but it was the worst pain I've ever felt in my life. And if I could just get it down to an 8 or a 7, I can walk around more, but at that level of pain, I couldn't do anything more than what I was doing, which was walking once an hour is about all I could really handle. And then I was feeling crazy because there were a couple of patients who were power walking through the hallways and burping and passing gas. And like, the whole time I was in the hospital, I never burped or let any air out any part of my body ever. The whole time that I was there, the whole 2 days, no air came out that way. So there was one lady who my sister was talking to who told her that she's had a similar surgery before or something like that. And she said she had her husband bring a massage gun and he massaged her back where she felt the gas like at, and that helped release the gas. And that's how she was able to burp and do all this stuff to let out all the gas. And that probably really helped. I tried to get my sister to like pat my back like you do a baby when you're burping them. But she was too afraid to do that because she's like, I was in so much pain and she just didn't want to be hitting any part of my body. But yeah, I hadn't seen anybody talk about using some kind of vibrating something to help get the gas out before in any of the videos. And I watched hundreds of videos about the surgery. So I will tell whoever's watching this now, if you get this surgery, if you can, and if you have somebody there with you, get some kind of massage gun or something so that they can massage your back and help you get that gas out. Because for me personally, walking did not help. After I finally got to my room and they showed me how to like unattach myself from everything and go on my walks, I walked a lap, two laps every hour, and I wasn't feeling any better. I was like a zombie, the living dead, walking through those hallways. It was horrible. The nurses were like, "You look so miserable. I'm so sorry." They are swearing to me, "Just keep walking. It'll get better. I promise." But I couldn't believe them. I was in such a delusional, painful place at that time that I just saw them as like masochists trying to like cause me destruction and torture because no one would help me with the pain. They came in and would give me, more nausea medication, more antacids, heparin, but nothing. Like they would give, then once I got to like the hospital room that I was staying in, they would give me Tylenol that I had to swallow, Tylenol pills. And that was excruciating as well. I wasn't really drinking any of my liquids. And no one gave me my inspirometer, my the breathing practice thing. I saw one in the room somewhere, but it wasn't anywhere I could reach. But no one gave it to me and told me to be practicing it or using it. It wasn't until I was checking out of the hospital that my nurse navigator came in and asked me, like, wanted to make sure I was doing it. And I told her no one had given it to me, and she was really upset because she was like, you have 2 different nurses you've been seeing and nobody, like, because they had it over near their computer, like not even a place where I could get it to. So no one was telling me to practice it. So I've been doing it very diligently since I've been home, but yeah, I wasn't doing it at all. And oh my gosh, the amount of like
heavy, thick phlegm stuck in my lungs from the intubation and the surgery. That was really painful to cough up, after having the surgery and having, all of your incisions, but it had to happen. But I remember at some point in the middle of the night, in my complete misery, by the way, I was having hallucinations from the ketamine the whole night. I sent my sister home like very shortly after I got to my hospital room because she had already been there at the hospital with me for 12 hours. So I was just like, have one of our relatives come pick you up, go home, go rest. There's no need for you to suffer any further. Like, I'm here with nurses. I have a nurse call button. Go get some rest because goodness gracious, the fact that we weren't in a room for so long and she was just sitting in these random chairs in the recovery room and she was starving, and like at one point she tried to open like a pack of peanut butter crackers to eat, and I was like, oh my gosh, no, no, take it out. Oh, I can remember that, the nausea. I like just the sound of her crinkling the paper before I could even smell the peanut butter was horrific. So for those of you who are being there for somebody during the surgery, please don't eat in the same room as them or put on perfume in the same room as them or anything like that, because we just can't handle any smells. No smells whatsoever. I mean, I was walking through the halls and I would smell like the nurses warming up their dinners. That was a killer as well. But I remember I eventually ran into a really nice nurse around 10 o'clock at night that night when I was finally a little bit more alert. And she was just came and like rubbed my back. I was just walking through and she just rubbed my back and she was like, you look so miserable. She's like, but I promise you, she said, the strangest thing is going to happen. She said, I bet you anything you're regretting the surgery right now, which I was. Surprisingly, as much as I waited for the surgery and as long as I wanted this surgery, at that moment, I mean, that day, that first day, I was regretting ever doing that surgery because I was in the worst pain I've ever felt in my life. And I've had surgeries where I've had pins put in my joints and in my bones and things like that. And that was nothing compared to what I was like with that gas pain was like from the surgery. It was definitely the worst pain of my life. I'm not saying this to scare anybody. I'm just saying, like, prepare yourself. Don't be shocked by the level of pain. And if you can find a surgical center who can guarantee that they're willing to give you pain medication, I would choose that place because there's no need to suffer the way I was suffering. There's really no need to have a major abdominal surgery with zero pain medication after the surgery. It was like human torture. It was the worst thing I've ever experienced. It makes me scared to have future surgeries, although no other surgery would ever do that. This is the only surgery I've heard of where they can't give you any kind of pain medication after the surgery. So, and the other thing is they wouldn't even give me my RA and fibromyalgia pain medication that they told me they were going to give me. And I kept asking them for, like, at least give me the stuff that helps out my joints and my regular body pain so that it's not as hard to walk around. They wouldn't even give me that. None of those are narcotics that I take. So that could have taken the edge off. But it was like they really didn't want me having any kind of pain relief. And those medications that I take don't slow down motility or any of those other things. So it was, I don't know why they didn't do that. When I started being able to take that when I got home, it helped a lot. So I've been getting out, moving and walking a lot more because I can control my other pains a little bit better. But that nurse that I ran into like at 10 p.m., she was like, it's the craziest thing, but she's like, you're gonna have a sudden, like some kind of switch that's gonna go off inside your body, and you're just suddenly gonna wake up and you're gonna feel 100 times better out of nowhere. So I looked at her and I was like, I don't believe anything anybody's saying to me right now. I feel so betrayed by this hospital because no one's cares about the amount of pain I'm in, which I'm sure they did care. My sister said everybody was very caring and very compassionate and nice and everything, but in my state, I couldn't see those things. All I could see was the extreme pain I was in and that nobody was helping me. So I'm sure the nurses and everybody were extremely nice, but to me, they were just torturous demons trying to kill me. And I couldn't really see any compassion because of how I was feeling. But this nurse, she like would rub on my back and walk me back to my room. She's like, I promise you. She's like, you're reaching right at that point where you're gonna go lay down for a little while, and then all of a sudden you're gonna wake up and you're gonna feel great, you know, and you're really so shocked. And she was like, I don't know what it is, but I've talked to hundreds of bariatric patients, and it happens to everybody. You suddenly wake up and it's gone. Like the gas is almost completely gone. And so she was like, there's some people that the moment they start moving, they feel a little bit better and a little bit better. She's like, I can tell that's not you because for every lap I did, I didn't feel any better. So every time they kept telling me, the more you walk, the better you're going to feel. That was not true for me. I wasn't feeling any better with any walking. I was just doing it because I was in too much pain to stay laying down in the bed. So I just got up and walked, even though it didn't make me feel any better, but it was the only way to keep my sanity, I guess. But right around 11 p.m., my nurse came in. And honestly, I don't know why they wait till so late because they did this with all of the patients, the other girls that were there. I talked to them as well the next day. They waited till like 11 p.m. and they came and gave us what they called a special bariatric nausea cocktail to help us sleep through the night because obviously nobody's sleeping more than like an hour or two because even for the people who weren't in as much pain as I was in, they were still in too much pain to get like true sleep. And the one of the positive things I can truly say about this hospital is they don't do unnecessary super like frequent checks on you in there. So if I wasn't in so much pain, I would have gotten plenty of sleep. My nurses were only coming in every 4 hours, and then the CNAs were only coming in for my vitals like 2 to 3 times a day. So it wasn't somebody coming knocking on the door every hour or anything like that. It was like every 4 hours, unless I called for something. Nobody was coming to. They were trying to let me rest. So when she came in at 11, she gave me some kind of mixture of like Benadryl, some kind of antacid, a different type of nausea medication that wasn't Zofran because before she was giving me Zofran every 4 hours. But she gave me something else, like I said, with the Benadryl and some kind of antacid, and she gave me Sudafed. There was something else in this cocktail, and literally as she's injecting that, I'm starting to fall asleep. Thank goodness I had just done a lap that I was supposed to do, and I started to fall asleep. And I slept for like 2 or 2.5 hours. That was the longest sleep I got since the surgery happened. And when I woke up from that, I was a completely different person. It was 100% true. It was like I woke up at 2 o'clock in the morning or something. Yeah, 1 or 2 o'clock in the morning, and I finally wasn't in excruciating pain. And so as soon as I woke up, I got up and started to do another lap. And all the nurses were like, oh my gosh, you look so much better. I mean, goodness, I could tell my face must have had a very different expression. I was actually able to smile at them for the first time since I've been at that hospital. I had not smiled at anybody since the surgery happened because I was in too much pain to even remember what it was to smile or find those muscles in my face. Also, I felt like the ketamine was still so strong in my system that first day that I actually couldn't feel my facial muscles. So yeah, it was weird, but I was actually smiling walking down the hall, and I did like 2 laps in a row. And on the third time I was coming around, that's when I finally ran into one of the other ladies who was. I had looked because so at my hospital, like you do the laps around your floor, and when you get to the end of your lap, they have like a whiteboard with your room number on it, and all the different people who are doing these laps for bariatric surgery, and you're tallying every lap that you do. And by that point, I had probably done 15 laps, but there was a girl who had already done like 30 laps or something like that, like twice as many as what I had done. And I happened to run into her when I was finishing that second lap, and she's like, "Oh my gosh, I've been wanting to come to your door to have you come walk with me, but your door is always closed, and so I didn't want to disturb you." And so my nurses were just closing my door because I was so miserable and I was moaning still so much in pain, and I just didn't seem like the person who wanted visitors, which honestly I didn't. And I don't even know if I would have been encouraged to talk to that lady then because I was in so much pain, and it wouldn't have helped me to see how much less pain she was in than I was. But she started walking with me then, and we did an extra 2 laps. And then she would come to I leave my door open, and she would come by my room every time she was ready to walk again, every hour. And we would walk like 4 laps. And that's how she was getting so many laps, is every time she would, every hour, instead of doing 1 lap like I was doing, she was doing like 4 to 5 laps and then laying down and then going 4 to 5 laps. And so that was not something I was capable of until I finally got that relief. But that's when she was telling me, I heard them trying to pull your tube out when you woke up, and you were moaning and you were in so much pain and begging for medication. And I was so shocked. She was shocked that they weren't giving me anything, because she was like, I was uncomfortable, but I was not in the kind of pain that you were in. And obviously everything affects everybody's body differently. I don't know if there's any kind of complication with my surgery. They didn't say there was. They didn't tell my sister, the doctor didn't tell my sister anything about the surgery when he came in to say it was over. He just said, the surgery went well, she's in recovery, you'll be able to see her soon. That's all the information she was given. So I'll probably ask a lot more questions at my pre-op appointment where I have the staples removed. Like, was there any hernias that had to be repaired? Were there any abnormalities? Like, what was there? Because the after patient summary for the surgery was more like my discharge after patient surgery summary. Like, no comments about my surgery have been posted on my MyChart yet, so I have no idea about the findings. Sorry, that's my dog laying down and hitting the tripod. But yeah, so I don't really know if there's anything abnormal with the surgery, why I was experiencing more pain than most of the other people. There was another woman who was on our floor doing the laps with us, not together with us, but she was a bit older. She probably looked like she was in her 60s, and she was having a lot harder time than I was. I wasn't the only one who was struggling, but she was, she barely, I think after we were getting discharged, she had probably only made 15 or 16 laps by discharge. So, but they still discharged her. I was surprised they discharged me, because I only, in that whole day, the 24 hours that I was there, I only drank 4 or 5 ounces of liquid the whole time. And I was supposed to be drinking 2 ounces of liquid every hour. And I only made it through 4 or 5 in 24 hours. But because I was up and walking, because I was trying to drink the liquids, they discharged me. And, thank goodness when I got home, I was able to start eventually. Like, that first day, I didn't get too much down. But now I have a whole system. I'll go ahead and insert a clip here, but I have these refrigerator organizers and these 2-ounce cups with lids attached that I got before the surgery. And each morning I just take out one of those and sit it on this little table right here that has a cup on it. And actually it's right there. You just can't really see it. And I sit on this recliner. I'm actually sleeping on this recliner right now too, since I need to stay at an angle. But I put it out there every morning, and I finish all of the little containers inside. And I know that hits my 32 ounces. And then I just have water in this little hydro flask it's a kind that's just a sipping kind without a straw. I have water in there. So in between drinking the cups of, the little 2-ounce cups of broth and Gatorade, I drink the water. And so that helps me stay on track. I know before the end of the day, I need to finish the entire little refrigerator organizer acrylic drawer. And then before I go to bed, I just rinse those all out, lay them flat to dry, and then I fill new ones to fill that one. And I have 2 of them, so I always have 2 days worth. But every time I go through one, I refill it for the next day or every other day that they're getting filled for, so that I can make sure I hit these goals. I think probably by next week, I won't need to have the little 2-ounce cups. I think I'll be able to just have Gatorade and a bottle of Gatorade and maybe a mug of broth or something like that, just sitting beside me up there, and I can just drink from there, and it won't have to be measured by 2-ounce cups, because I'm doing really good with the fluid intake, surprisingly enough now. I'm doing really good with it. So unless something changes, I shouldn't have to be so meticulous with the 2-ounce cups. But yeah, so I started to feel really good that next day, and then it was night and day. I was getting all the walking in. I was able to like wash up a little bit at the sink and wash my face and, put on some deodorant. And those are just things that I just wasn't capable of doing initially. I do have a small little clip as well about what is in some of the stuff I packed with me. I didn't do a full like what's in my hospital bag thing, but the video before this, I showed what, some of my preparation for the surgery and what my pre-op diet was like. And then I show some of the stuff I packed. Things that I truly needed and I used that I would definitely suggest is having some kind of like wet wipes, whether it's like feminine cleansing wipes or just baby wipes, to just clean yourself up a little bit, so you feel fresh and you don't feel gross, because it's very easy to feel that way in the hospital. Bring your toothbrush and then bring some kind of facial moisturizer or hand moisturizer, because I wasn't able to, you're not able to put any moisturizer on before the surgery. My face was like so dry that it hurt to move my face skin. Like it was so dry after surgery. So as soon as I felt well enough, I had some Neutrogena, like the individual wrapped facial towelettes, and I was able to wipe my face down and then put on a really light moisturizer. And that helped so much because it was actually getting painful that my face was so dry. So I would definitely suggest, again, like some feminine cleansing wipes or baby wipes, facial wipes, because bending over at a sink or anything like that doesn't feel very good. They did have like, I think there's a little video of what my hospital room looked like that I'll show you over as I'm talking right now. But in my bathroom, they did have like face towels, hand towels, washcloths, and stuff like that. The bathroom that was in my room, it was a room, thank goodness, by myself and with my own bathroom. And I was able to a few times to just wet that rag with water and just wash my face, which was just really helpful to make you feel like human and alive. But having that, like having something to wash your face, moisturize your face, having chapstick. Oh my gosh, if you can get some unscented chapstick, because I love mint chapstick normally, but the mint chapstick was almost too much. It almost made the nausea worse. So if you can find yourself some unscented chapstick to bring with you, 1,000% is a need. Because after the intubation and the severe dehydration that you're going to have because you can't really handle the liquids, your lips are going to turn into something that you can't even recognize. So bring some good chapstick. I just had to grin and bear the minty scent, but at least the mint filling felt really good, and I needed a lot. I'm still like needing to exfoliate my lips 3 days later from the level of chap that they became until I had enough clarity of mind to remember that I had chapstick. Something else that was really helpful is in my backpack I took, I don't know if you can see right here behind me, this little bag right here, this like a little Vera Bradley cosmetic bag. I had a bag that the bag is about this big. It's not too small, it's about that big. I had that in my hospital bag, and that inside there was chapstick, hand lotion, the face lotion, the face wipes, a portable charger for my phone, and probably like one other thing I can't really remember. But those are things I knew that I wanted near me, like on my bedside, like, or on my table, so I didn't, even if I didn't have the strength or energy to get up and go to my full backpack where it was sitting, that little bag was able to be just tucked by my side of the hospital bed or on my bedside table. So having some little bag that could stay right next to you, so that if your support person isn't there or a nurse isn't there to hand you anything, that you have all the things that you need close to you in a small enough bag to have it literally right next to you if you need it. So I would definitely suggest something like that. That's very, very helpful. But yeah, so that morning, I was able to get lots of walking in, start getting my fluids down. I didn't need any more anti-nausea medication after whatever that combination was that she gave me that night. I didn't need any more nausea medication or antacids or anything like that after that, from that point on. I think they gave me a few more heparin shots, and then they told me, then my doctor came, and that was... My doctor was a really nice guy, but he wasn't as attentive, I think, as he should be, and he wasn't as detail oriented as he should have been. So when he came in and just talked to me, he still didn't tell me how the surgery went, and I still didn't have all that much clarity of mind. Sorry, my dog's still pushing this a little bit, so let me move it. But I didn't have all of that clarity of mind to be able to ask him any questions. So he just, kind of told me to drink as much fluids as possible when I get home, but don't push yourself to nausea. It's not worth throwing up. That's going to make you feel worse. If I can't keep my fluids down, call them. They'll set up an infusion. Don't go to the hospital unless, it feels like it's life and death. They have a 24-hour line that I can call. Stick with your bariatric center because they're the ones who know how to treat anything that's going sideways after the surgery. The hospital won't really know what to do for you as well because it's bariatric specific what you're having, whatever's happening to you. So I haven't had any kind of concern. I was gonna possibly reach out to them and ask them about the swelling in my ankles, but I have a feeling that's normal because of this high sodium liquid diet that we're on. And I'm very sensitive to high sodium, and this is something that happens when I take high sodium. So I think it's just normal. I should just leave it be. I'll mention it at my pre-op appointment. It's not uncomfortable. It's there, it hasn't gotten uncomfortable yet. Sometimes this kind of swelling can get really uncomfortable for me because it'll happen around my entire foot and then it hurts to walk. If it reaches that point, I'll definitely reach out to them. I do have some older diuretic high blood pressure medication I was given a long time ago that if push comes to shove, I can just take that once or twice and that'll, push the excess water out of my body. But I don't think they'd want me to do that right now because the whole point is to kind of actually get your body to retain fluid. To prevent dehydration. So I think they'd rather the swelling than dehydration. So, but yeah, my doctor just talked to me for a few minutes and then he left. He didn't check my incisions. He was supposed to remove my bandages, check my incisions and staples, and go over using the, the breathing apparatus to help prevent pneumonia and some other things, and he didn't. So when my nurse came in right after, she was like, wait, your doctor was in here just now, right? And she's like, yeah. She's like, he didn't take off your bandages or look at your incisions? And I was like, nope. And I don't know what was going on there, but she was really confused and disappointed, so she had to take off my bandages and check my incisions and then go over using that breathing thing with me and all that. But yeah, otherwise I was doing really, really well. Seeing my incisions for the first time was shocking. For some reason, I was under the impression that I would only have staples at one of my incision sites and not all of them. I thought maybe like the biggest one would have staples or something like that, but every incision has staples, so it's very Frankenstein looking right now. And I'm really hoping this staple removal isn't too painful. Like, I'm hoping they numb it and it's an easy thing, but I honestly don't have much pain at my incision sites. Crazy enough, it's just the one that's right up between your breastbone, the one that your bra strap touches. That's one is sore because it's being touched by something all the time. But otherwise, I've been wearing really loose fitting sweats, really loose t-shirts. Abdominals are still really swollen, but it's fine. And yeah, so that's what the surgery and these first few days have been like. And I will probably do another update once I do the staple removal to let you know how that process went and any updates that the doctor or the nurse practitioner will give me at that time. All right, thank you so much for watching and thank you for joining me on this journey, and I'm so happy to share this with you.